morning everybody and welcome to Badger's Den in Rochford. Today we are here with our lovely MP, Bayo, is representing at Rochford and South and East. So Bayo, who taught you to clean your teeth?
Welcome Robbie, it's good to see you. Good question, who taught me to clean my teeth? I would say it was my mother primarily, but I was the youngest of 6 in my house, so I know that some of my older siblings sometimes were tasked with watching to see if I cleaned my teeth properly. So mostly my mother, but I think my older sister would probably say that she had some responsibility in that as well.
So how do you clean your teeth now?
I clean my teeth. I use a toothbrush. I don't use like an electric toothbrush. I always sort of use the sort of manual one, and I clean my teeth twice a day. And I suppose maybe over the last 20 years, I've become more thorough, and as I've become a bit more sort of aware of dental hygiene. And so yeah, it's twice a day, and I have a sort of set routine, if you like, of how I do it, where I start, where I finish, and so that's how I've kind of learned to sort of brush my teeth, really.
How many times a day do you clean your teeth?
So I clean my teeth twice a day. So I clean it in the morning, and then I clean it at night before I go to bed. So there's probably the odd occasion where I may clean it sort of a third time if I've had something really, really sweet, like I like donuts actually, so jam donuts actually, they're the only donuts you can have. But anyway, so so sometimes I find myself, if I feel that it needs to be done, then I'll do it a third time.
And do you mind going to the dentist?
No, I don't mind going to the dentist, but obviously I'll be honest with you. Yeah, there's been once or twice in the past where I felt a little bit uncomfortable. I mean, I cracked my tooth years ago, and I just had this period of maybe a year or so where I probably didn't go to the dentist quickly enough, and it became another problem. And that's the issue sometimes when it comes to sort of like dental issues and your mouth. Sometimes it's about being, it's preempting some of the issues. So I didn't go quickly enough, and it meant that I had an infected gum, and it was a bit of a tough time really. And then that really made me realise that I do need to go whenever I need, whenever my monthly checkups are due, go, and if there's a concern, go, and so I've got into that routine.
And did you have braces when you were young?
No, I did not have braces when I was younger. I didn't have that, which was fortunate. That was something else that I didn't have to sort of learn to do and manage brushing my teeth around it. So no, I did not have braces.
When did you last go to the dentist?
The last time I went to the dentist was probably about 18 months ago. Yeah, which is not
good enough.
Yeah, which is not. And funny enough, I am due to go in the next few months. My wife and kids are going next week, and it's something that I've not really done. I should have done certainly more recently.
Has he been busy, do you think, Robin?
Yeah. I've missed a couple of appointments.
Did you know the mouth can tell us a lot about our health? And do you think we know enough about dentistry in your constituency?
Certainly, I've learnt to know that the mouth tells you a lot more. I always knew sort of the eyes is something that you can pick up certain things around people's health through eyes. I didn't quite know as much regarding your mouth, and that's something I've learned sort of over the years. But I'm fully aware now that it tells you, it can tell a lot, and it's something that I suppose we all need to know. We all need to sort of, in terms of our families, if spot science people, work colleagues, that kind of stuff. And so I am aware of that. The other issue, I suppose, is certainly in and around sort of South and Rochford, South and East and Rochford, there isn't enough dental care. There isn't enough dental provision. So I think the community knows that. Part of my job is to try and make sure that the medical authorities who sort of fund and organise dental care, healthcare and dental care know that. So I've had sort of meetings since I've come into office and conversations about what we can do around sort of increasing the amount of dental care in this part of the area. They're receptive to it. They're also receptive to, they also understand that sort of people with special education needs are, they also, like everybody, can suffer from sort of poor dental health care. And they're aware of the anomalies there, which is that sometimes sort of healthcare issues, or certainly sort of poor dental practices, are not picked up enough, and so it's an issue that they need to sort of focus on. Because if they can deal with better dental healthcare, then it stops other sort of health concerns further down the road. So it's all about preventative care, which means it's less intrusive, it's less impact on your health. It's early diagnosis to so many things, and so talking to the local sort of health administrators, they are aware of it, and there are services that they want to sort of put in place, and they also want to work with organisations such as yourself as well. So that's the most important thing, is really it's making sure that the health managers and the guys who plan services talk to the experts and the organisations that have the greatest access. And so that's something else that's coming as well.
And did you know that people like me need to be even more careful about going to the dentist, because we are at high risk of something called aspiration pneumonia?
I didn't know that that people sort of had a greater sort of, a worse experience, and it kind of indicated sort of an issue with regards to sort of further healthcare concerns further down the road. I didn't know that originally, and it's something that I've learned over the last few years. But what I would say is that through meeting yourselves and organisations such as yourself, you've taught me a lot. I've learned a lot, and I think I touched on it earlier in one of the earlier questions. What you're finding is that we've asked questions of the clinical sort of commissioning body, and they can help, and they're willing to help, and they know how they can help. So they know how they can track people's sort of journey into the healthcare system, and they can see sort of like where there's particular gaps. There are things that they feel they can do in terms of additional checks, also sort of outreach programs as well, and finding sites. We're looking to sort of for sites that are in this particular area as well, so that will help, and sort of like workshops as well, to try and help sort of impart more advice about good practice around sort of mouth hygiene and things like that. But certainly it's something that has been mentioned, we've mentioned it, and they were receptive. They actually started thinking about it as well, so I'm sure some of the work that you've done has already got to them. So the conversation I had was really about, okay, give us an update, what are you doing? So that's been provided to us. So I feel quite confident that the sort of, the healthcare sort of management, if you like, the people who commission the services are aware of people in the community and how they can help you further.
How do you think that you could help the Making Care Fair campaign find better solutions for people with high support needs to keep that the teeth are healthy?
Another issue that, again, talking to the commissioning board, they were aware of, but it's something that not enough people actually understand, is that we've got something like 1 in 4 people in the community sort of have access to or have a much higher level of poor dental hygiene, and so that is a community, that is a stat that is quite easy to see, and it shows that we do need to think ahead, and we do need to be really proactive about sort of how we support all people in the community as well. And so I think that really does need to concentrate the mind of the commissioning bodies about how we can support people. And so I think they're aware of that, and I think that's something that we're working towards as well. And so with your help, coming meeting you, coming here, it tells me what else I need to do, and and where we can sort of put a bit more pressure on the commissioner body to sort of do more and quicker. So that's something I'd like to say as well today.
Thank you so much for
Robbie,
coming
thank
today
you.
at Badger's Den.
Thank you very much.
Mr. Speaker.
Order.